How do you know that your parent needs some extra help? What are the first signs that you might see from someone who's showing a mild cognitive impairment? In today's video, that's what we're going to talk about. Before we continue, I just wanted to quickly introduce myself. I'm Tammy Provenzel. I'm a dementia certified physical therapist and a life coach. And I wanted to emphasize that the videos that I make are separate from my role as a physical therapist working in short-term rehab and long-term care facilities. I've been working with elderly patients and their families for 20 years. I see the struggle, especially in the role of caring for our parents. There's a lot of emotions that are involved in that. So these videos are part of my effort to bring information and strategies to the families that are struggling with how to care for their aging parent. So when it comes to dementia, there are a bunch of different kinds, and the symptoms can vary. We're going to talk about the first symptoms you might see in somebody with a mild cognitive impairment, the beginning stages of dementia. There are also times where mild cognitive impairment doesn't lead to dementia. So some people will get a mild cognitive impairment and just kind of stay there instead of progressing to dementia. Today we're going to talk about 4 common things you might see in the early stages of dementia. The first one is memory issues. Most of us know that memory issues are one of the first things you'll see in dementia. Your loved one might forget people or places that they used to go to all the time. They might misplace objects, their car keys. They might forget faces. And a lot of times the person will acknowledge that. They'll say something like, sometimes I'm forgetting things that I used to be able to remember really easily, like where I put my car keys or what I was just talking about. The second symptom you'll often see in early dementia is communication issues. So they might struggle to find the right word or to have a full, complete conversation. And that can show itself in using incorrect words. So the person might say something like, I know what I want to say, and then when it comes out, it's all jumbled. Or I know what I want to say, and I can't find that word that is used to describe it. There can be difficulty with processing sounds. So it might not just be the ability to speak and communicate, but to hear others' communication. And that could be that if there's a lot of background noise, it's hard to focus on what you're saying to them. Sometimes sounds blend together, so it's hard to decipher what's being said. It's like the filtering system can't filter out the background noise. It's hearing everything. So the person might say, it's like the words all blend together and I can't make sense of them. So they might ask people to repeat themselves a lot, or they might just nod and smile because they're not understanding, but there's a part of them that doesn't want to let those around them know that. So they're just going to nod and agree. The third symptom you often see in early dementia is visual problems. And one of the biggest problems when it comes to fall risk is visual depth perception issues. So if I see the chair over there, I might misjudge how far away or how close it really is. And so if I reach for the arm of the chair, I might overshoot it or undershoot it and end up falling. And then with visual challenges, you'll often see difficulty understanding what an object is. Could be something they've used their whole life, like a toothbrush, and have difficulty comprehending what that is used for. Another visual problem can be contrast sensitivity. So this includes things like there are certain colors that are harder to see, certain colors that are easier to see. It can also include things like a carpet or a threshold between rooms can actually be perceived like it's a hole in the floor. And so sometimes you'll see people stumble or struggle to place their foot over that threshold or place their foot over that edge of the carpet. Another visual challenge you'll often see is in visual field. What often happens with people with dementia is that their visual field gets narrowed. So they don't have as much peripheral vision, and that's both ways. So for the person with dementia, that means that their world is much smaller and they can't see outside of those. So what that means for us as a caregiver is we try to stand in front of them. We try to come to eye level when we're speaking to them. And then one of the hardest challenges, I think, with people with dementia is if they have visual hallucinations. So they might see something like a shadow and visually interpret it as somebody sitting there, or again, like a rug looking like it's a hole in the floor. And then the fourth symptom you'll often see in early dementia is misunderstanding of social cues. So they'll often misinterpret what someone's saying to them or how someone is responding to them. So they might think someone is angry with them when they're not, or they might think that someone is being serious when they're not, or they might think someone is kidding when they're not. And this confusion comes both with what they're seeing and what they're hearing. So facial expressions or tone of voice can get misunderstood. And then especially because it's the early stages, the person might realize that they're doing this, that they're experiencing this, and they can feel embarrassed that this is happening. So they might feel embarrassed or frustrated when they're in social situations because they're aware that they're not understanding everything all the way down from what they're seeing, what they're hearing, and the social cues that they're trying to pick up. It makes sense why a lot of older people shrink their world, meaning they decide that they're not going to participate in social activities. They're going to go out of the house less because it's easier to control their environment in that small space that they're used to. So although there are many more symptoms associated with early dementia, I just wanted to talk about 4 that you'll often see. So hopefully today's video was helpful. If it was, please like and share this video with anybody else you think might get some value from it. Subscribe to my channel, and thank you.